So, good afternoon, respected judges and my dear friends. So, my study is on a randomized control trial between sodium hyaluronate and trehalose in dry eye disease. So, dry eye is a multifactorial disease of tears and ocular surface. It causes discomfort, visual disturbances, and tear film instability, damaging the ocular surface. And DED worldwide incidence are 5% to 50%, and it is more seen in females. And there is this increased dependence on digital devices has further enhanced the prevalence of DED. According to TFOS and DEW second, they have redefined dry eye as multifactorial disease of ocular surface where loss of tear film instability and hyperosmolarity leads to ocular surface inflammation and damage along with evaporative and aqueous deficiency dry eye disease. So there is a new topical drug that is trehalose in combination with the existing lubricant that is sodium hyaluronate is a naturally occurring disaccharide has proven to improve tear film homeostasis and benefit patient of DED. The mechanism of action is it increases the autophagy, it protects the cultured human corneal epithelial cell membrane, it prevents cell death from desiccation, it preserves the normal cellular morphology and functions of cell membrane and their proliferative activity. So what has been done previously? So there are many randomized clinical trials, but the most studies they have inadequate sample size or the patient were not followed for long enough. Only Chiambara et al. They evaluated more than 100 patients in a RCT between sodium hyaluronate trehalose combination and sodium hyaluronate alone. So we planned this RCT along with larger sample size of 384 with 192 patients in each arm. This is the highest sample size in all worldwide studies. Participants were 15 to 74 age group, OPD patient complaining of dryness, watering, grittiness, burning and hyperemia, OSDI of more than 9, shimmer and TBUT less than 10 seconds included in the RCT. Patient with chronic drug intake leading to dry eye disease were also included. Exclusion criteria: prior ocular surgery and any previous ocular lubricants, AGM, and failed to give consent. Clinically assessed by OSDI questionnaire, shimmer test, TBUT, fluorescent test, Van Wisselois conjunctival staining score with rose bengal strip and follow-up of patient on 4th and 8th week. So these were the results: female 59%, male 41%. The shimmer test, when we compare from the baseline, so it improves from 6.12 to 11.36 with a significant p-value in the trehalose group, and no in the standard therapy of sodium hyaluronate alone, it increased from 6.12 to 9.82. And we compare the tear film breakup time, so it was again significant p-value in the trehalose group as compared to the SH alone. When we compare the tear film height, so it was similar in both the groups, and when we compare the Van Wisselois scoring, again it was similar in both the groups, and again it was similar in the OSDI in both the groups. So in the discussion, in this randomized single mass clinical trial, we found that treating dry eye with sodium hyaluronate trehalose leads to greater improvement in shimmer values and TBUT compared to standard treatment with sodium hyaluronate alone. And Chiambara et al. They also showed that trehalose is effective and safe with better patient satisfaction than existing hyaluronate only eye drops. Merits of our clinical study: largest sample size worldwide, strict adherence to randomization and masking protocols, relatively long follow-up. Demerits: lack of use of more sophisticated tools for tear film assessment which might influence the subjective OSDI scoring. Thank you so very much.
You have used trehalose only in dry eye cases,
Yeah.
not any other cases like keratoconus, or have you used and have seen that?
Yeah, we are giving in the post-op patients also. We have started giving in post-cataract patients who are means dry eye patients. So again, we are using it. Also in the refractive cases when we are doing LASIK, again we are using the trehalose.
You are using post refractive cases also. You are adding
Yeah,
trehalose.
yeah. And results are really good.
So do you add trehalose exclusively is also present trehalose?
Okay.
So mainly it acts as a mucolytic as well as an it has an osmotic protective
Yeah,
action.
cryoprotective and autophagy,
Autophagy.
more known as bioprotectant, along with autophagic effect. Yeah.
What is your observation with minimal cases and severe cases, like Zogrens?
No, I have no experience in using it.
Severe dry eyes, is it effective?
Yeah, it is effective. Severe dry. Yeah, yeah. I shows in the table,
Study.
so it's very effective. Yeah, it's effective.
Thank you.
Thank you so very much.